examiners were so frustrated by some common mistakes that they actually made a list of what not to do in the exam. And fixing this can instantly boost your score. So let's talk about them. First, avoid any double bowel questions. So rather than asking, do you have vomiting or diarrhea, which sounds quick, but can create confusion, ask the patient one question at a time. Have you been vomiting? Listen to the answer. And then have you had diarrhea? So that you are clear and safe. Second, be careful when you are using medical jargons. It's fine to use technical terms. You are a doctor after all, so of course you can use the medical terms, but always explain them immediately. If you say renal calculi, then immediately say, which means kidney stones. That's good communications. That's clear for the patient as well. And that's what the examiners want to hear. Third, avoid any kind of bland reassurance. Saying eat a good diet or take antibiotics sounds lazy. So you have to be specific. If you're talking about diet, then say more fresh vegetables and whole grains or whatever is appropriate for your case. Specific diet plan. Or if you're prescribing, then at least name the medicine. Don't say, I'll give you antibiotics. Say, I'll give you amoxicillin. And if you know the dose and the duration, you can talk about that too. That's the level of detail expected from you as a doctor. Fourth, avoid vague words. Terms like nasty lump or bad growth, which are commonly used by IMCs, and I do not know who made them so popular, confuse patients and can give false hope. Be clear and direct. You can rather say, we're concerned that this lump could be cancer. You can say it kindly, but you have to say it clearly so that the patients understand the seriousness without any confusion. And finally, don't just say you'll examine the patient without actually examining the patient. If you say I'll examine the abdomen, then go ahead, perform the examination. You can verbalize your findings and you can talk about the steps you will do in the examination, unless the examiner has asked you not to do that. But do the examination if that's your plan. These are simple habits, but they separate an average performance from an excellent one according to the AMC examiners. And if you want to learn about these kind of tips and for detailed guidance of more than 300 exam topics, head on to learnmedicine.com.au. Keep practicing. All the best.